Hi guys, I just got home from seeing a plastic surgeon. I went in for a consult to discuss treatment options for my scars, for my acne scars of course. And yeah, just got home, so I wanted to make a video letting you guys know how the consult went and some information that I got out of the consult, the treatment options that he recommended, and of course, most importantly, the fees. The dreaded fees. But anyways, let me just start with the actual consult. So in the consult, the first thing the surgeon asked me was my acne history, and so I kind of told him my whole story and how I've been acne or free of acne for several months now. And he just wanted to make sure that my acne was under control before any acne scar treatment was done. And then the second thing, and he kind of really put a strong emphasis on this part, he told me that there are definitely a lot of different treatment options to improve the appearance of acne scars, but that none of them are going to give me perfect results. I'm not going to have perfectly smooth, baby soft, or baby smooth skin. The best he said that he could guarantee me is a 50% improvement. So, and he said that a few times. Not exactly what you want to hear, but it's definitely something when you go speak with a plastic surgeon or a dermatologist about treating acne scars. Don't let anyone fool you into thinking that any one procedure is going to restore your skin back to what it was when you were, 10 years old. Acne scarring, it's a very severe problem. Scarring it's a severe problem, and especially with acne scars, you often need, there's not one miracle treatment. So yeah, I was happy that he kind of emphasized the fact, which it made me trust him right away. So then he examined my skin to see the type of scars that I have. And I always referred to, in all the prior videos that I've made where I discuss my scars, I always refer to my scars as ice pick scars. But he said that's not what I have, because ice pick scars are really deep set scars, and that's not what I have. He said I have rolling scars. When you have rolling scars, you have kind of like a wavy texture to the skin, and that's exactly what I have, like all along my cheeks. And in addition to that, I do have these like hollowed areas, like right here and a little bit right here. So I have these wavy like texture to my skin, and then I have some hollows in the skin. So he said the best treatment option that he would recommend for me is doing two things. The first thing he would do is treat the hollow areas. And to treat those, he said he would go in and break up the scar tissue, and then he would fill the hollows with a filler. And the type of filler that he uses is Juvederm. More specifically, he uses Juvederm Ultra Plus. And so this type of filler, it's a gel filler. It's made of hyaluronic acid, which is a substance that is naturally occurring in our body. So it's not a completely foreign substance that's going to be injected into the skin, which is always nice. And some of the side effects to this Juvederm filler is that it can cause some redness, it can cause bruising, and it can also cause lumpiness in the skin if it's injected improperly. If someone injects it in the wrong place, if they inject too much, it can create kind of lumps in the skin. The redness and the bruising, he said, should only last a few days if you have that side effect from it. And then the lumpiness, if you do it, he said he's thankfully never had to do this, but if he somehow makes a mistake and I end up with any lumpiness from the filler, there is an injection that he can use to completely dissolve the filler, and then you just kind of go back to where you started. It doesn't make the acne scars worse. It doesn't create a bigger problem. The filler is just completely dissolved, and then you just go back to where you started. So yeah. So that's the filler, and that's the first thing he would do. And then he said a few days, he would give me a few days to heal. And then I would go back and he would do a laser resurfacing treatment. And the one that he would use is the CO2 laser. And the reason why he would go with this laser resurfacing treatment is because one of the main problems that I have, I don't have really deep scars, but I do have scarring over a large area of my face. Like this whole cheek area is scarred. So because it's such a large area, the best way to treat the scars is through a laser treatment. And he would do the CO2 laser. And I don't have a lot of information. I literally just got home, so I haven't even like Googled any of this stuff. Don't have a lot. I don't even remember what he showed me, like pictures of what the CO2 laser can do. I think he mentioned that what the CO2 laser does, it smooths out the skin, and it really like stretches out the skin, so it just looks a lot smoother. And it's not a type of laser that has to be repeated every few months. If you do the CO2 laser, you do it once and that's it. He said if the patient wants to do it again, the patient can do it again, but it's not something that he personally recommends. And so as far as the fees for these two treatments, the Juvederm Ultra Plus, he quoted me $550 for that. So to go in with the filler and fill in the hollow areas that I have would cost $550. And then to do the laser resurfacing, that's $2,000. So the total cost of this little surgery here would be $2,550, and that's just for those two procedures. And then there's other fees. I think like there's like a fee for booking your appointment, which is like $100, and then there's like some other fees that are not listed in my quote. But the surgery itself would be $2,550. I'm guessing if I were to do it, it would be like a max of $3,000. So if I decide to do it, I have to save, or I need to have $3,000. Which I don't know. I kind of so it's not cheap. But I was thinking, when I got out of the office, I was like, man, that's a lot of money. I'm not going to be able to do it. But the more I think about it, these two treatments, I just do them once. Like, I will pay the $2,550 plus those extra fees, and I'm done. Obviously, knowing me, I won't be happy, and I'll want to go back and do something else. But it's not something that they say that they're telling me up front, oh, you're going to have to come back in 6 months. Like, no, if I go back in 6 months, it's because I want to. So at the end of the day, it's not that bad. It's just $2,550 and you're done, hopefully. So I probably am not going to do anything right away. I need to look at my finances, see where I can save some extra money, and yeah. Oh, and I'm going to Miami. So yeah, definitely won't be doing the acne scar treatment because I'm going back to Miami for the Thanksgiving weekend. I'll be in Miami. So yeah, the acne scar treatment thing's not happening right now. Definitely not. So it's just something that I'll think about for maybe even early next year. I think for this year, going to continue to live with the scars and just deal with them, and then if I do something, it'll probably be next year. But yeah, so if you have any questions for me, let me know, and I will talk to you soon. Bye.